Good evening, AOBE members, BISD employees, and Brownsville. Veronica Borrego, AOBE president here, and next to me I have Miss Ida. Hello, Miss Ida. How are you doing this evening?
I'm doing good. Doing good. How are you doing?
I'm doing good. It's been a long day. We had a training after school, and it's been a busy day.
What was it a training on?
Telpis.
Oh, nice stuff.
Yeah.
So, especially with this day of ugly weather, it is so yucky outside.
It was a day that I wanted to just be in bed under my blanket, cuddling with my puppies, and watching a movie.
Exactly. That would have been a perfect day. I think for anybody would have preferred that. But ni modo, we're fortunate enough to have a job to go to. And so we were able to do that today. So many people who don't have that opportunity, unfortunately.
Yep.
But other than that, just continuing to stay busy with everything.
Yes, for real. I did want to bring up briefly that some campuses have already started to receive their replenishment of sanitizer, wipes, spray, disinfectant sprays, and all that. But there's some campuses that have not. So those campuses that have not received, if you could please reach out to us. I know I had to sign a date for mine. So if you have not it should have already started trickling out to everybody. So please contact us, send us a message on Facebook Messenger, and let us know whether or not if you have not received your replenishment of PPE.
Definitely. And what I've heard so far was that there was not everything was in the packages, the replenishment packages, and there was some issues and concerns with that. So if that's what's going on, those were, thank God they were corrected, and they were able to get all of their supplies. So if you are not receiving your supplies, or if it's not complete with some of the important stuff that you are going to need to be able to do your job, please do contact us. And I know there's also quite a bit of issues and concerns with the accommodations that are not being met, and with the increased amount of positive cases. So we're continuing to push for that, for true transparency. So, we ask you, please be patient with us on that. But the good thing is, hopefully everybody got the message that tonight we are going to have Dr. Eder Hernandez with us.
Mm-hmm.
So, and he'll be able to answer questions of COVID, or any questions on the vaccine and things like that. So hopefully we get a good amount of audience members with us to be able to ask some questions. And it should be a very interesting show. I know his time is very valuable. So we want to try to keep it to the positive, not positive questions, but informative questions that he'll be able to help quite a bit of our audience members, or people in our population area that are working in the school district and stuff. So we did get a few questions already. And so we'll start off with those. But any other questions that you just want to maybe put in the message bar, and we will get to those as soon as possible. And so, oh, there he is.
Hi, Dr. Hernandez.
Hi,
sir.
Hello, guys. It sounds pretty distorted. Does that sound better?
You sound great. I can hear you.
Oh, yeah, I can hear. Let me see if I can log out.
Okay.
Oh, okay.
Log back in.
Okay. I feel mine is kind of loud, but
I think you sound great. But
I think it's my headphones. I'm not used to the headphones. I think que me los puse muy recio.
You can lower the
But
volume on them.
mande?
I don't sound loud to you?
No, I sound like my own voice
Your
is
own
like
voice.
I can hear it, but anyway, um, so I can imagine how Dr. Hernandez's schedule must be right now. So we really appreciate him making time for us here a few minutes. We really do appreciate your time, sir. Is that any better?
That sounds great. Thank you.
Okay,
Oh,
perfect.
how are you doing today, sir?
Good, good. I was still working, so I am sorry. I just got on kind of quickly here, so
Oh,
I'm ready.
Not a
well,
problem. Yeah.
we do appreciate your time,
Sure.
and if you don't mind, we're going to go into some of the questions to that our members have submitted and are messaging us, and so we can go over that. And I'm sure the majority are going to be COVID based because that's probably what you're getting everywhere you go. So
Sure.
we appreciate you making the time for us. So, Veronica, I don't know, you want to get started on this?
Yeah, for sure. What do you recommend if someone does not take the vaccine?
So in COVID-19, I think with the vaccination plays an important role for mitigating the disease. The question becomes, how fast can we get the vaccination out to the individuals? So we've had 30 million vaccines allotted to the United States, and there's only been 15 million applications of those vaccines. That's obviously a problem. That we're not, I don't see general population getting the vaccine no sooner than the summer. And to vaccinate, 50%. The Dr. Fauci mentioned vaccination of 70 to 80% of the individuals will give us herd immunity against the virus. So this is going to be a long time. Uh, and it's important that you get vaccinated. If you choose not to get vaccinated, that doesn't change anything. The standards are the same. You need to continue with the social distancing, using the face mask, and what we've kind of been doing this whole year.
Okay.
Mm, okay. And what are the most severe side effects that you have seen with a person that has taken the vaccine? Have
You
you
know,
seen a lot of that?
Yeah, so for example, my staff got their second dose of the Moderna vaccine today, and we had to close early because they were having aches and pains and all types of, they're mild to moderate symptoms. Anywhere from fatigue, headache, fever, body aches, lots of pain in the injection site. But all this is only for 1 to 2 days. So if you can write that, you can write the train for 1 or 2 days. You should be just fine. It's better than being on a ventilator. It's better than putting your life at risk because this virus is killed individuals that are extremely healthy and people that are not healthy. So it's too much of a risk. So it's important that you get the vaccine, but we do have some moderate effects, side
Mhm.
effects. These vaccines are new technology. The mRNA vaccines are new technology, never been used before in the world. So there's obviously going to be more of a robust side effects on the second dose. So the
Mhm.
first dose of the injection for Pfizer and Moderna, what it does is the scientists decoded the protein of the S protein of the virus from SARS-CoV-2. That protein attaches to our cells. Once that protein attaches to the cells, then it injects its genetic material into our cells. So the scientists were able to take that protein and kind of like a binary code in when you're doing computer work, computer science, and they decoded the whole genome for the virus and for the protein, and they inject that into the human cell, and then our own cell machinery takes that and transcribes that into the S protein. So we make the protein by the genetic information that is given to the ribosome in the cell. Once that's made, then your body creates these specific antibodies to the S protein. So the first dose, it gives your body the blueprint of the S protein, but your second dose, you've already created antibodies, so you're going to feel it. The second dose, you will feel it. Some people need to, take the day off work, one day, the next day. That's fine. It's perfectly fine. You can take Tylenol. But it's important that you get the vaccine. If you get any opportunity to get the vaccine, just get the vaccine. It's extremely important. And it's really important people get their vaccination.
So that's the most that you've seen, like a good 2 days of the body aches and things like that.
Yeah, I was part of a the human clinical trial for Moderna in September. So I put myself as a subject for science just because I've been at the forefront since March, and the faster we get people on these clinical trials, the more vaccines are approved for the general population. So once I have a doctorate in medical science, so I kind of studied the vaccine from how it works in our system, how it's developed, and I felt confident. At the worst, the mRNA of the vaccine could disintegrate because it's such an unstable method. It's not a common method; it's new. So I took the small risk and I got it, and I've been immune since September. So I got Moderna in September. Thank God I was part of it's either placebo or vaccination. So thank God I got the vaccine. And my second dose, I had a day and a half. I felt like I was hit by a bus for a little bit, for maybe a day and a half. I went to work in the morning, and then I came back and took 3 hour nap, and then I took one Tylenol, and the next day I was like normal. So,
oh wow.
The second day you feel it, the second dose you feel it, but it's nothing that you really can get past.
Yeah, it's definitely something to consider, to go through that instead of the other possibilities that people are going through, unfortunately, with this virus.
Yes.
You mentioned, Dr. Hernandez, that you had done a trial. Can people still sign up for trials?
Sure. So we're actually the only. So we have ValueMed Urgent Care. We teamed up with Centex Studies. Centex Studies is a very, very large organization that all they do is clinical research, and they ran some studies for Moderna, for Pfizer, up in AstraZeneca, up in McAllen. They're in McAllen, Houston, and in Louisiana. So they teamed up with us, and we actually have a clinical trial ongoing today already, and it's the Janssen Ensemble trial. So that's based out of my office. We're the only clinic that has it, and we can get you. My email for that is Eder at centexstudies.com, Eder at centexstudies.com. Send me an email, and I can get you on the list. And we bring you in, we give you a screening, we make sure that you qualify for the study, and then we explain it to you. And a good way to put it out there is, Janssen is a very famous pharmaceutical company. It's owned by Johnson and Johnson. So these are pharmaceutical giants. This is a DNA vaccine. It's different than the mRNA vaccines. The side effect profile is a lot less. So you have a lot less side effects, guys. So they already did a study for their 1-dose vaccine, and with 1 dose, they have very good efficacy. So this is the trial that I'm running as a sub-investigator for them, is a 2-dose. You get one on day 1 and the second dose on day 57. So they're trying to compare if you get that second booster, do you have more antibodies or are more immune for longer periods of time? So it's completely free. It's paid by the federal government, pays it. You get there's a stipend for whoever enrolls. And I tell anyone, if you're not able to get to the lines, and you're not on this special tiers to get the vaccine today, if you do a vaccine trial, it's phase 3, so it's very safe. Once you get to phase 3, safety and efficacy have been looked at, and if it wasn't safe, then it wouldn't pass all those inspections, right? So once you get to phase 3, it's very safe. It gives you a 50% chance probability of getting your vaccine immediately. Tomorrow I have 10 patients that are coming in for the vaccine trial. So the issue with that is one person gets placebo, one person gets the vaccine.
Right.
And so I'm the investigator and I'm blind, so I don't know what you get. The unblinded pharmacist that has the product by Janssen prepares it. I inject it in the individual, but we don't know what you get. Now, an important point to look at is, let's say Veronica and Ida come in and it's a 1-to-1 placebo, the vaccine. Ida gets the vaccine, Veronica gets placebo. Obviously, I don't know, you don't know, but you can call us and say, look, I have, let's say you call us 3 weeks later and you say, hey, I have an opportunity to get my Moderna vaccine tomorrow. I would like to know if I got placebo or vaccine. And legally, because of the public health emergency, we're legally bound to tell you what you got. If you got the vaccine, then you hit a home run and you're fine. Just continue in the trial because it's still very effective. It's effective. If you didn't get the vaccine, well, it's really simple. You jump out of the trial and go get your Moderna shot. So it's a great way to get ahead of the line, guys.
And absolutely.
I can do as many as I want. I mean, tomorrow we have 10 patients scheduled. This is going to be going on for a couple months. I mean, if we could do as many teachers, as many people that need the vaccine, that can't get the vaccine. You don't want to do the lines where you're waiting, 10 hours in line, and then you get to the vaccine and then you're out. They're out.
Yeah, absolutely. That's a good way to at least start, and then they can continue to try to get the vaccine, and then if they do come across it, but it's not easy at this time.
Yeah.
To come across it.
So remember, it's the Janssen COVID vaccine clinical trial. There's a lot of information online, but that's the vaccine trial that we're actually running here in our office in Brownsville.
So if anybody's interested, they can email you at that email address that you said, Eder at syntechstudies.com.
Yes, ma'am.
That? Is it SEN or SY?
Syntechstudies.com.
SEN.
Eder is EDER at Centex, CENTEX, syntechstudies.com.
Okay, so we lost him.
I just put it in the chat.
Oh, okay, good. So
he's here.
Oh, I'm sorry.
That's okay. I just put the
and
email in the chat.
The bug. Let me see. The bug is back. Can you hear me?
Yeah, we can hear you.
Yeah, we can.
I can hear you. I have to leave and come back.
Okay.
Okay, go ahead.
Yeah,
so,
I put the email in the chat already. So if anybody wants to contact him, you all can contact him through there.
Yeah, definitely. So we're going to continue with the questions, and if there's any questions any of the audience wants to ask Dr. Hernandez, you can go ahead and put that in the chat, and we're going to try to get to as many questions as we can. So is that any better, Dr. Hernandez?
Yeah. Thank you, guys. It's just that I get phone calls all day and all night, so they'll take me off this meeting.
No,
I can imagine.
No worries. We'll keep bringing you back on. Don't worry.
Yes, definitely. And I do have to say that I do know several people that are under your care, and all have spoken very highly of how you have gone above and beyond for them during this difficult time of the illness and stuff. So great shout out to you. You and your staff are doing an amazing job. So we thank you for that. Definitely.
No, we appreciate it. When we just have so many calls coming in, it's hard to get to get to everyone. But if for some reason you're needing help and you need a test or you have COVID, You can drive up to our location and just park outside. We will get to you. Our lines are completely, sometimes they won't answer just because there's so many calls coming in. But if you're needing help, we're always available. We always have a provider on site, and I'm literally work 7 days a week, so we're always ready to help.
Definitely.
Yeah.
And so let's continue with some more of the questions so we can get as many as we can, because we know your time is very valuable. So does the vaccine, what you have seen, does it protect against the new strand that they're talking about that is starting to, spread a little bit more?
Yeah, so there's a couple strains that are concerning, specifically the UK strain there's a mutation. So as we discussed, that S protein is where the virus attaches to our cells. So if you imagine that the vaccine produces antibodies where that attaches, if there's any mutation in that, this could potentially not grab it, right? So it's an issue. But the scientists really have looked at that and mentioned that it's going to take a long time. They specifically years for so many mutations to happen where those antibodies are rendered ineffective. So it's a good sign for us to get the vaccine. Now I'm also a national speaker for a flu drug, and I'm considered a local flu expert. I've spoken on podcasts around the U.S. Regarding flu. If you look at your flu vaccine, it's not just one strain of the flu. There's multiple. When you get a flu vaccine, it's a quadrivalent vaccine. There's 4 strains in that vaccine. So I believe down the road next year, it's possibility that you're going to have a Moderna booster with 2 or 3 strains of the virus, right? So it's going to progress into something like this.
Oh,
okay.
Okay.
Go ahead, Beth.
Is getting a vaccine safe if you have a lot of allergies?
Yeah, the vaccines are very safe. Basically, if you understand what the virus does, Veronica, the virus attaches to our cells and then it hijacks our cells. It's kind of like a bank robber. They go in there and they hijack the cashier to make them do everything that they need them to do. So the virus hijacks our cells. With this new with this vaccine technology, we are using our intelligence and our own cell machinery to create what we tell it to make. So we're telling it to make the protein to recognize this virus. So it's very safe. It doesn't affect anyone with allergies. There's so much more benefit than any risk that I've seen.
Okay. Now, I believe, do you have small kids, right?
Yes.
Young kids? Okay. So how have you explained COVID and what's going on to the youth, to, children? Because I know a lot of people are having a very difficult time and they're scared seeing, so many illnesses, going on around us and things like that. What do you recommend on how to explain this properly to the kids?
Yeah, and I think it's something that we are seeing increased amounts of depression, anxiety, post-traumatic stress disorders in adults and kids. Unfortunately, even for me, I learned a hard lesson. I get home and I'm just talking about COVID. I get the phone calls and my son, and they hear these things, they internalize these things, and it affects the mentality. And so at one point the kids, they don't have a conscious mind. Their subconscious and conscious, it really is merged up until the age of 12 when they can make conscious decisions. So anything under 12, they can internalize that and really have issues. So we highly recommend that kids get a proper dosing of vitamin C, vitamin D, and that they see the sun. You have to have the children play outside 15 to 30 minutes, right? And that they get the sun exposure. If you look at studies, people in Alaska, have very little time with the sun daily. They
Right.
have 1 or 2 hours, and those people are always depressed. They have high amounts of
Yes.
depression. So it's important that the kids go out and play in the sun. And it's important that they do not watch and hear all the negativity on the news. Okay, that's an issue. Explain it to them like uh, it is a virus, and as long as we protect ourselves by hand washing, keeping our distance, and staying away from sick people, and getting a vaccine when it's time. I can tell you right now that I'm trying to land a study for Moderna vaccine for kids between the ages of 12 and 17, and that's already going on right now in this moment. There's already vaccine trials for the same Moderna vaccine for children between the ages of 12 to 17.
Wow.
Oh, wow.
So that's a great news for the whole community and for the United States. It's already happening. Okay.
Absolutely.
So that's a good sign. Um, uh, uh, Adults get an injection of 100 micrograms of the mRNA. They're testing less of the of that micrograms of what they inject in these children, but it's safe and it's effective. So we're gonna get a vaccine for kids. That's another one down.
Awesome.
Yeah, by the summer we should have an emergency authorization for another one for the kids.
Well, oh, wow. But in the summer, you're thinking it's going to be the trials, or you think it's already going to be the vaccine available for the children?
The trials are going on right now.
Oh, okay. Okay.
The trials are
Oh.
on. The trials are on. I'm trying to push a trial for here for that. And we'll see if we land
Oh,
it. Yeah.
awesome.
That's awesome.
That
Yeah.
would be great.
Does getting the vaccine mean that we will not get COVID?
No. So I give you an example. We had one member from our medical team got the vaccine, Moderna vaccine, and then 10 days later he tested positive for the virus. So the efficacy comes after 2 weeks after the second dose. So you get your first dose, right, and then you get your second dose 28 days later, and then it takes 2 more weeks to produce all the antibodies. So you're really not fully protected until 6 weeks after your first dose, right? It's 6 weeks. So I'm telling everyone, when you get your vaccine, for the next 6 weeks, you have to be as careful as you can so you can develop all the antibodies before getting sick. Okay, people have gotten the vaccine and gotten sick within that first 2-3 weeks. So just because you get a vaccine doesn't mean that you're protected that moment. There's obviously things that need to happen in your body for you to create the antibodies. So and then when you get the full 6 weeks, it's only 94 to 95% effective. What that means is 94% of people are covered, but there's that 3 or 4%, that is a possibility they can get the infection. It can be so mild they can miss it. They can just it will lessen. So when you look at the vaccine, they look at endpoints. How many people got the virus with the vaccine, and then how many people were hospitalized and extremely sick? So those are the endpoints. Now, one thing that is not known is if you get the vaccine, you can still have COVID-19 infection in your nose, and can you spread it to others? That's one thing that is unclear. So it's important that people continue using their masks, because you might have the vaccine and be protected, but the other person in front of you doesn't have the vaccine, and you're going to give it to them.
Wow,
that's what scares me at times. That sometimes people have that mentality, thinking, "Oh, I got the vaccine. I don't have to be as careful."
Yeah.
I got the vaccine in September, and when I see patients and I consult positives, and I go to immigration facilities and I see positives, I do lots of work. I have my mask, I have my face shield. I'm not taking any risks. I don't want to bring that to my household.
Absolutely. Absolutely. And how long, I know you mentioned about when you've gotten the vaccine and you still have antibodies, but how long is the vaccine effective?
So the CEO of Moderna recently came out and said you're at least immunity on the efficacy of 94.5 for at least 1 year.
Oh, wow.
Minimum 1 year. it really looking like 2 years, but at 1 year, it's guaranteed. It's almost guaranteed. So I think with a yearly booster, we're gonna be just fine. We're gonna come out of this mess. We just got to get people vaccinated. That's the most important thing.
Awesome. Awesome. That is really good news. I didn't know it was up to that long. I was
1 year,
wondering about that.
1 year immunity.
Oh, great.
Wow, that's awesome. Which there's several vaccines out. Do you recommend one more than the other?
No, at this point, we have to understand how this works. There's phase 1, phase 2, phase 3. I'm doing a phase 3 trial for Janssen, and then after phase 3, the government issues an emergency EUA, emergency use authorization by the FDA, but it hasn't been vetted by the FDA. It's just approved for emergency. Okay, so all these vaccines will come out with an EUA because it hasn't been fully vetted by the FDA. It's just we're in a public health emergency. They're trying to get as many vaccines out. They're going with the data that the researchers are giving them. But usually on a vaccine can take 5 to 10 years to develop, because of all the regulations. So it's important that you get the vaccine as fast as you can. And to me, the Pfizer is 95% effective and Moderna is 94.5. They're equivalent. They're same technology. Those are the only two that are approved or EUA authorized at the moment. Janssen is next in line. And so whichever one you can get.
That's the one that you have the trial right now is the one that you said, right?
Yeah. Yes. Janssen has two. Janssen has a 1 dose, 1-time shot, and you're good to go. And then they're doing a 2-dose, and I have that. We need to enroll 60,000 humans all over the world. And so until we get those 60,000 people, then it doesn't. They can apply for the emergency use. For Moderna, it was 30,000, 15,000 placebo and 15,000 vaccine, and then they went to the government and they got the approval. I was one of those 15,000, and I'm so happy I did it. I took a risk, but you know what? I've been immune since September, so that that brings a lot of peace of mind.
Mm-hmm.
Yeah,
absolutely. So I know it's going to be different for everyone, and I know you've seen a lot of different things out there. But what are some of the long-term effects that you've seen so far with patients that recovered from COVID?
Yeah, this is a serious matter. COVID. It's such a. It's just a virus. I actually hate COVID. It's just. I mean, the spectrum of disease is so broad. You can be asymptomatic, have no symptoms. 40% of people have no symptoms, right? And a lot of those are kids. They can spread it to the adults. Okay, that can happen. And then you can go to the spectrum of being extremely ill, where you're on a ventilator and you can die. So, the spectrum of the disease is very. It's all across the board. So it's a difficult thing to really pinpoint.
Mm-hmm.
Mm-hmm. Yeah, because I had seen some of the stuff on the news about how they were discovering the lungs of the COVID patients that had recovered, and they had as much damage or even more than a smoker. And that's why.
Let me tell you this: I have patients that have had thromboembolic events from the virus, because you can die from a blood clot from the virus can cause blood clots as well. So I've had patients that have had abnormal brain scans, CAT scans, MRIs, neurological function just from the virus. Okay, they have a sort of mental fog, mental confusion afterwards.
I heard that people say they have COVID brain, right? That's what they call it.
And it's a problem. And then another thing that happens that people need to be aware is after people recover, they go into a lot of people go into something called post-viral fatigue syndrome, or a type of encephalitis, myoencephalitis. So basically, after your body recovers from it, your body is so inflamed from the virus that you're just fatigued all day. You're tired. you're tired. You're tired all day,
Oh.
and they'll come back to us. You know what? I had COVID a month ago. I really feel like I'm weak. I have no strength, and that's very hard to treat. It's very hard to treat. Some of the other viruses that cause post-viral fatigue syndrome are like influenza and mononucleosis. These viruses cause this. Okay, so I've seen that. I've seen neurological issues. I've seen people have heart issues. You know, there's people have heart. The virus inflames the heart, and so now I have them with cardiologists to try to make their heart stronger. So this virus is very nasty. It's nasty.
Yeah.
It has
Yeah.
no rhyme or reason, right? Like it's just all over the place. There's no.
What happens, Veronica, is the virus replicates so fast and it causes so much. Your body is a machine, and your body is ready to fight. So what your body does, it cannot gauge how to destroy it because it's a novel. It's a zoonotic virus. What does zoonotic mean? It came from an animal to a human. Okay, it's completely foreign. So your body, you know, instead of bringing a simple gun to a gunfight, it brings a machine gun and bazookas and all types of defenses, but that actually affects your organs. So your body cannot gauge. It just completely obliterates, and everything starts swelling and getting inflamed, and then you see the long-term effects. You know, so one of my there's no cure for COVID-19. We've been privileged to work with Dr. Joseph Varon. He's the chief of staff for United Memorial Medical Center in Houston. He's part of the frontline COVID-19 Care Alliance that I'm also an alliance member. He developed a protocol, and that protocol, he has a 6% death rate in the ICU compared to the United States. Everyone else in the United States has a death rate of 30 to 35%. He also developed a protocol for outpatient management. And we have been very aggressive here in the community with outpatient management. And people, you know, some clinics will say, you know what, just go home, see what happens. But we don't allow that. If you have COVID and you have high blood pressure, I'm going to put you on aspirin for a whole month because you could have a blood clot in the middle of the night. Okay. So we're going to be proactive before you have any complications. So my goal when someone has COVID is the prevention of the long-term complications from the inflammation of the body. The virus doesn't kill you. Your body destroys the organs. So my goal is to prevent your body from going into haywire quick. So we do have, I don't want to say cocktail because I really can't say cocktail, but we have a protocol and a outpatient management that has been very effective, and we've managed over 3,000 COVID-19 positive patients. And our death rate, you can say it's a fraction of a percent. And the people do extremely well if you start early. If you come to me, you've been sick for a month, that's an issue. But you get the virus with us. You test positive. We're already on top of what needs to happen next. We're not waiting. We have multiple providers. I'm the main one that deals with all the positives because of the experience that I've developed. After seeing thousands of these cases, you just become a subject matter expert just by default. And then we have people like Dr. Varon that have been. I met him this past week, and I was in Houston. He's actually a hero, national hero. Houston, now the mayor declared Joseph Varon Day. I don't know what day it was, but he saved so many lives, and he saved a local physician, friend of mine. We had to transfer him from a local hospital here because they would not use his protocol. We had to transfer him to Houston to Dr. Varon's hospital, and Dr. Varon, first of all, God, and second of all, Dr. Varon saved his life. So now that physician is back seeing patients and is alive. So the protocol works, and I wanted to personally thank Dr. Varon for his guidance, and he's taking care of my patients as well. I've had patients have to go there because some of the local people are not doing the protocol that he has. So we're looking for answers anywhere and anyone that can help us. We're not staying with our arms crossed.
Yeah.
That is amazing that you're staying on top of all of that with your long days that you're doing, and but you're staying on top because so much is changing with this virus, and the different protocols, the different things that they're doing. So God bless you for that.
Thank you.
Vero, you want to take the next?
Yes. So one of the questions is, how right now we kind of have the way the system is, it's not very orderly. And so the lines are really long. And so one of the questions is, do you recommend that an elderly person with a compromised immune system get in the long lines to wait for the vaccine? Or do you suggest that they wait until it gets a little bit more organized?
Yeah, I mean, the vaccine is an issue. The solution is actually simple. The solution is simple. The government is giving the counties major doses. You're talking about 5,000-6,000 doses. Okay, that's what the government is doing. Now, the local clinics, they should submit a list of their highest risk patients to the county, and those people need to be vaccinated. If you have a 65-year-old with severe hypertension, diabetes, and so overweight, and you have a 20-year-old, who you want to vaccinate? Which one would you want to vaccinate first?
Yeah, absolutely.
So,
You're 65.
what's happening is that those people that go in are waiting. It's a free for all. They're waiting in line, and they beat everyone else because they can afford to be in the car for 24 hours, and an elderly can't. That's an issue, and that's a way to help. Another way, and I was talking to the county judge just yesterday on this. He says we need to encourage every single clinic, PA, doctor, nurse practitioner, pharmacy, to apply for the vaccine ASAP. Okay, apply. I just applied. I got approved. I checked on my website today. I have 0 allocations over to me. As soon as I get an allocation, what I'm going to do is I'm going to identify high-risk individuals that are my patients, right, that need the vaccine. And that's what everyone should be doing. They need to be enrolling themselves. And that's the issue. The enrollment is so low. The county has no experience in mass vaccinations. They've never seen this before. And let me tell you this, they've done a great job, but they cannot do it by themselves. They just cannot. We're in this business. We're in healthcare. We've been doing this. I've been doing this over 12 years now. And the reality is, we apply vaccines on a daily basis. It's something that we do all the time. So the clinics should enroll. And if you use 500 doses, they can send you 500 in 2 days.
Wow.
And you have your list, right? So you don't want to because it's so expensive. You don't want to lose it, right? The product is so. If you use 300, then you order three. You use 300, then you can order 300, but you have your list ready, and you keep going. So I'm happy to say I've been approved. I've been given
that's awesome
an approval, and I'm just waiting for the allocation. At least from our side, we're going to look at the higher risk patients. I mean, I have patients that are 80 years old, and those people are going to get it. They're at higher risk. So with the county and with all the clinics, if they enroll, even the pharmacists now can vaccinate you. Okay.
Wow.
And actually, I want to take the time to give a shout out to HEB Pharmacy in Central Boulevard. The pharmacist in charge has been amazing. He helped vaccinate my whole staff.
Wow.
These people went above and beyond. We were the first clinic in pretty much the valley to get the vaccine at HEB. And it was an amazing thing that they did for us because we're in the front lines, and my patient, the front line, if your front line is sick, they can't tend to anyone else. So those people need to have the vaccine.
Wow.
Believe it or not, there's still people in healthcare that have not received the vaccine.
Really? That are working in healthcare?
Yeah, they're looking for the vaccine and they can't get it.
Yeah. I thought that they had already, the majority of them had already gotten it. So that's pretty sad. So hopefully the system gets a little bit better and moves along a little bit smoother. So can a person that has had COVID be vaccinated?
Yeah. So So, for Moderna, they recommend 90 days period. If you've had COVID within 90 days, then you cannot get the vaccine. But if you've had COVID, it's been past 90 days, you can get the vaccine. With the Janssen vaccine trial that we're doing as a sub investigator for Janssen, if you've had COVID in the past, you're not excluded from the trial. You can still get it because there is a component of natural immunity and a component of immunity from the vaccine. So they're both very helpful. So you just cannot get the vaccine if you have COVID active because you're going to have a bunch of problems. Okay.
Mm-hmm.
Oh, okay.
Wow. Okay.
One of the questions is, if you get sick from the second dose, do you have to quarantine or can you return to work?
You mean if you have a side effects?
Yeah, it says if you get ill from the second dose. So I'm guessing, yeah, like if they have side effects or whatever, do they have to quarantine or can they return to work?
The reality is, the second vaccine is going to give you moderate symptoms, right? Mm-hmm. So if you have body ache, chills, headache, fatigue, those are all common. Now, if you develop a sudden loss of smell and a severe cough, those are not symptoms of vaccine. Those are symptoms of COVID. Do not go to work. Go get a test. Don't mix those. People don't mix those two because if you're not fully vaccinated and it hasn't been 2 weeks after your second dose, you're still not fully covered. You can get COVID at any time within that time.
Mm-hmm. Wow. Okay. Now, Dr. Hernandez, I know that you had a very tight schedule, and so if you need to go, just let us know because the questions are coming in, and I don't want to keep you longer than what you need to, because I know your time is very valuable on this. So you just let us know, and we'll go ahead and stop. Or if you have time for like a few more questions, you tell us.
No, I can take maybe 3 to 5, 3 more questions. It's fine.
Okay, let me see.
One of the questions is, will you have the vaccine at Valley Urgent Care?
Yes, like I mentioned, I'm approved and I'm just waiting for the allotment. But to be honest with the viewers, we're going to identify our patients that are high risk. We're going to identify those people. We have a duty to those people to vaccinate them. And we have a duty to the community. So we're going to identify those people before anyone else.
Do you recommend the vaccine for someone who has gotten sick before with the flu shot? Or
you're not supposed to get the vaccine if you got the flu shot 2 weeks before or 2 weeks after. So if you get a flu shot and get the vaccine, it's already a no-no. So if you're planning to get the vaccine, get your flu shot now. We have the flu shot at the clinic. Get a flu shot, and then you have to wait 2 weeks. After 2 weeks, you can get your Moderna vaccine. I think the most important thing is I personally seen lots of flu, and I have a machine that I can tell you in 15 minutes if you have flu and if you have COVID. We've diagnosed so many patients with flu A, flu B, and COVID at the same time. They have all 3 things or all 2 things. And those people are higher risk, high risk for complications. So get your flu shot as soon as you can.
Okay. So is the booster going to be administered at the clinics next year, or do you foresee that it's going to be how it's right now, people having to get in line for hours and stuff?
No. Every clinic and every provider will migrate into having their own stock, and I think each clinic will take care of their own. And I think the local health departments have 3 or 4 locations that they'll have the vaccine available. So it's just right now is a cluster, but it'll get better. Just be patient, and if you know someone that it needs the vaccine, don't go take their spot that fast.
Absolutely.
Help them out. They shouldn't be in the line 24 hours waiting. It's a sad deal there.
Absolutely. On this one, would an anti-inflammatory diet help to build up an immunity?
Yes, I think something like turmeric helps inflammation. Vitamin C, taking 1 to 2 grams of vitamin C daily is amazing. Helps the immune system. Taking zinc daily. Melatonin is a natural hormone that they sell over the counter to sleep. That's been shown in studies to decrease inflammation markers. So melatonin is very safe. Vitamin C, zinc, and those are the vitamin D. There's some correlation with extreme disease and vitamin D deficiency. Now, 7 out of 10 people are deficient in vitamin D. So you should be taking a regular vitamin D daily until you know your real counts. You go get a blood test at your clinic. You can come with us. Go to your regular doctor. Go to your PCP. Know your vitamin D level. People with vitamin D deficiencies have a lot of issues with COVID. Their mortality is high for some reason. Vitamin D plays a role. It's a hormone. It plays a role on immunity. So it's important that you know your levels.
Wow, that's good.
Let me see. Is there a reason? Is there a reason why people may not be applying for the vaccine?
Like doctors' offices and things like that.
There hasn't been a lot of education on how to do that. I think the understanding is the governments are trying to go through the health departments, and I think they're seeing that's a roadblock. And they just got to encourage more people to. But there's different clinics that have received, but very little amounts. So it's happening. They just need more. So the county judge told me yesterday, we need everyone to apply. Everyone. If we have 200 clinics in the local area that they all get, 500, how many doses would that be?
That would be amazing.
That would be 20,000 doses, right? 20,000 doses. And if we do that cycle, we can vaccinate 100 to 200,000 people in a couple of months. Very quickly. 2 months. Our goal, if we vaccinate our community, we should have a goal that in the next 60 days, we should vaccinate everyone here, and just get it out of the way.
Yeah, absolutely. So what are your recommendations for someone who is sick right now?
If you're sick with COVID, you've been diagnosed either by rapid test or PCR. I was the first healthcare provider as a PA. We're cutting edge with our technology. So I was the first individual to order an outpatient infusion for positive patients. So the government bought $375 million of monoclonal antibody infusions, and that was to keep people out of the hospital. So we thank the Cameron County Emergency Management Division. The chief there contacted me about that amazing therapy. I was the first one to order it. I think they've done over 250 patients. I think they've done at least 50, 60 patients of mine. And those are for high-risk patients. But once you get the infusion, on a high-risk patients, you prevent really the hospitalization and the progression of the disease. So there is options out there. It's also sad to see patients that are positive that could qualify for this infusion. They're just told to go home and to isolate. Well, that's not the solution. That's also a problem. So if you need help and you're positive and you want a second opinion, as long as you bring us the results, park outside, we'll have an option for you. There has to be something we can do for you.
So you're still taking new patients?
Oh yeah, they drive up. You just drive up every day. The issue is the phone lines, guys. They're blocked. They're literally they're tied up. There's hundreds and hundreds of calls coming in. So if you drive up, we're literally addressing people as they drive up.
Oh my goodness! Wow.
There's questions about vitamins. How much vitamin D do you recommend? And are Centrum vitamins okay on a daily basis?
Yeah, I think Centrum is great. It's not enough for a deficiency. So the important thing is to know what your level is. You should be between a 30 to 100 level of the vitamin in your bloodstream. Most people are under 30 and they're considered suboptimal or deficient. And so if you're deficient, you need to increase it. They sell over the counter 5,000 units. That's an okay dose for an adult. That you can take on a daily basis, depending on where your deficiency is at.
Mm-hmm.
Okay.
Okay.
Awesome.
And
So
the deficiency we find out from like a blood test?
Yes.
Okay.
Okay. So someone is asking, so I can take my dad tomorrow as a new patient to your office?
Yeah, they can go to the Alton Glore location. It's 800 East Alton Glore. I'll be there at 9 in the morning. And I'll be there from 9 to 8 p.m. I got a long shift tomorrow. I work all day, so I'm there all day.
Wow. Okay. So that's good. So with that, there's several other messages saying you are amazing. We are blessed to have you in Brownsville. Dr. Hernandez, may the Lord bless you and keep you safe and healthy. So there's a lot of other messages like that. So we do thank you, Dr. Hernandez, for your time. I know there's more questions, but we'll end up keeping you all night, and you have a very important job. So we thank you for everything that you do, and exactly how that person said, may God bless you to continue to stay on top of this and do as much good work as you have been doing. Like I mentioned, they've spoken very highly of you, of how you go above and beyond for your patients. So that's amazing.
Yeah, so we appreciate the invitation, and really this has been a humbling experience for everyone. And there's a lot of people that are hurting, and we have the knowledge. As a PA, we're patient advocates, right? And so I have extra training. I have disaster medicine training on my doctoral medical science degree. But as a PA at heart, our and that's how I practice medicine as a PA. Patients come first, and they're at the end of the day, we need to have compassion for these folks, and we need to be able to help. And so that's one thing that I wanna thank all of our advanced level providers, all our nurse practitioners, all of our PAs in our group, our physicians that are in our group. We want to thank them for just going above and beyond. And it's not just me. I'm a face because a lot of people know me, but there's a whole team behind us. Okay, Valley Med Urgent Care. There's a large team of providers. There's a lot of people that I've trained over the years that we've hired. So they're working behind the scene, guys. It's not just me.
Yeah.
There's no way. It's called teamwork, and it's also called trust. If you trust us, we're gonna do our best to help you get better.
Okay. Somebody's asking again for your address and the name of the facility.
Oh, so it's Valley Med Urgent Care. The address is 2534 Boca Chica Boulevard, and 800 East Alton Glore. Phone numbers are 518-7444 and 546-2000.
2000.
And we have a third location in McAllen, but for teachers and as well. So that phone number is 731-6699. Valley Med Urgent Care McAllen. We have 3 locations here in the Valley.
Okay. So the first one you said 548-7444. Was that correct?
518-7444.
Oh, 518. So we can.
70.
Okay.
7444.
7444. All right.
And you work out of both locations in Brownsville, the Alton Glore and Boca Chica, or are you just at Alton Glore?
No, I just flop between all of them. When we have patients for the clinical research, I'm the sub-investigator, so I'll be in Alton Glore, but I can see anyone, as long as they let me know, I can see them, I see the patients that they need to be seen.
Awesome. So again, we thank you for your time, and someone says you are an angel here on earth. So, we know, yes, there's a team alongside you doing all of this work and helping you out. But, it's a very difficult time. It's difficult on our end, what we're seeing, what we see our school employees going through. So we can only imagine what you see and how difficult that is on you. So, it's definitely not easy work for you to do. So, God bless you again. And you are an angel for everything that you're doing.
Well, it's our job to take care of you guys. We appreciate it. You guys have a good night. Thank you.
You too.
Thank you.
So much.
Good night,
Oh,
Doctor.
okay. Bye-bye.
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 No, the McAllen is one of the places where the trial is being administered, but he said he's also administering the trial at his office. And I attached in the chat the email, which was eder@centexstudies.com, and it's Centex, CENTEX studies at .com. So it's in the chat somewhere. I can't even find it. But yeah, I did type it in there. Eder@centexstudies.com. And then, of course, I put in the address and the phone number. I didn't get the Boca Chica address, Ida.
The Boca Chica, 2534?
2534 Boca Chica?
Boca Chica. And I think probably if anybody just Googles the Valley Med Urgent Care,
Yeah.
and that would probably help to be able to find it. So that is very good. I mean, I've heard from several different people that are under his care that unfortunately are positive, and all have said, you know, how he has gone above and beyond checking on his patients, and it's a lot of people, unfortunately, that are positive in this area. So, I mean, I'm really considering going and signing up for that trial because, like he said, we have to let the people that are at higher risk have that opportunity to get the vaccine. So, thank God, my mom was able to get in to get an appointment in Hidalgo. And she's scheduled for the vaccine this weekend. She is elderly and high risk, several underlying health issues. But I'm thinking of signing up for this, and then we'll just see if it does become available. He mentioned, you know, they'll disclose it to you if you've gotten the vaccine or not. So that is definitely one way to go about that.
Yes, and it's very good to hear that the trials have begun with the students.
Yes.
I mean, that would be such a huge relief, I know, for educators, just knowing that, you know. I mean, yeah,
we've been seeing a lot of younger ages coming out positive. So hopefully, I'm really glad to hear that. That was such a relief, and to hear that the vaccine is good for up to a year. So that was really good. We apologize if we weren't able to get to all the questions. The thread was kind of like we're jumping around, and we were trying to get to as many quick questions for him. So we apologize if we skipped your questions. So I don't know if you want to go through any more.
Hello, Miss Zarate. Good evening, Miss Chavez. Miss Nelda. Hello, Miss De La Cruz. So he said you have to wait the 90 days. You should not be getting it if you currently have COVID, and you have to wait the 90 days after you have tested negative. Are the COVID protocols at the individual campuses individual, or are they standardized protocols?
At the campuses, it's supposed to be, the same thing for every campus. Unfortunately, it's not being done. We're hearing that, and we're hearing also at some of the departments. So you have to let us know if the protocols are not being followed at your campus. Please do.
So let's remind everybody. So you have the 3-day incubation, right? Those 3 days don't come from COVID leave, and they don't come from your days. Those are incubation days that are covered by the district.
And the incubation days, though, you have to have been exposed at the workplace.
You have to have been exposed to a confirmed positive at the workplace. So those 3 days are free. Then you have your 10 COVID leave days that the district has approved. And then, of course, if you have to go into any of your days, then you would have to go into your days. Then you have the questionnaire that you should be answering. We are hearing that there are some issues with the questionnaire being answered for people without them being present. And so we're going to see about making it to where It's either done through an email so that it's time stamped and different things like that to have proof that the person is actually responding. And that's one of the things that we're going to be looking at. And what else beside that? Those are the main protocols I think that we have to be worrying about and making sure that is being followed the same in every single department and at every single campus.
I saw one of the questions. I don't mean to skip, but I saw Miss Eva's pop up where she's saying, we were told no 3-day incubation at my campus. If you were exposed at the campus, at the workplace, you are entitled to that. So ask for it in writing, where they are denying you the 3-day incubation period, and then let us know. Because as long as you were exposed at the workplace, you're entitled to that.
Yes. We sound great.
When we're testing the mic at the beginning.
The dog that was barking was my crazy Molly, of course. I heard a report that numbers might be leveling out.
Not yet. Not yet. I think I did hear that there was like a little bit of a dip, but it was just a little dip. So
I got the vaccine and only felt sleepy and sore arm, felt tired, but it could have been the 6-hour wait. Well, maybe.
Sure. I think one of our members, Tanya, felt the same way.
California stopped. Okay, so we didn't get to that question. Sorry. Hello, if you get ill from the second dose, are you in quarantine or safe return? We did get to that one.
Yeah. You just want to maybe answer it really quick, really fast, Vero?
He said, as long as it is not COVID symptoms, you should be okay to return to the workplace. If you have COVID symptoms, then you need to report to a doctor to get tested.
Mm-hmm.
I tried to get my parents tested, but they told me I didn't meet the requirements.
Yeah.
It's Centex. SCENTEX. I signed up for the vaccine. However, I'm a little nervous due to me getting sick when I used to get the flu shot years back. Oh, we did ask him that one.
Yes.
We did ask him that one.
Mm-hmm.
He did say, do not get the shot within 2 weeks before and after the flu shot. He did say that. About the students' trials, yes, that is great news. Yes.
Mm-hmm. And that they last a year.
Yeah, so it will become like the yearly flu shot. That's what he said. He did, however, say that there were occasions that it may extend to 2 years, but they were still looking into that. Well, you have they will have it at Valley Urgent Care. He said they applied and got approved. They just have not received any of the vaccine.
Which is good. That is amazing. I really hope more doctors' offices do that.
Is the booster going to be administered at the clinics next year, or would it be like right now where the people? I'm assuming it's going to be through your doctor's office. So
he was saying that hopefully a lot more of the doctors, they should be coming on board with this and stuff. So we shouldn't be going through this again. Hopefully, God willing. Yeah.
Can a person that had COVID get the vaccine? Yes, as long as they're negative 90 days after a negative. What an he answered that one. Well, I don't remember what he said about that. The anti-inflammatory diet.
I believe, like he said, like certain foods and stuff, that it helps. The bottom line is on that. I mean, if you're eating anti-inflammatory diet, it only helps your body in so many ways. Because, I mean, you'd be surprised with how much you feel of a difference when your body is, inflamed, I guess, swollen and stuff. I have a lot of issues with that. So I try to do some anti-inflammatory foods, but fall off of that wagon pretty often. But you do notice a big difference. You feel better. You feel more energy. You can feel your circulation a whole lot better. So, I definitely recommend that. But he did say, your diet does help you.
Ugh, I need to work on that. Can someone get the virus again? There has been so much uncertainty about that. Yes.
Mm-hmm.
People have gotten the virus multiple times.
Yes.
The body builds immunity not for life, So those 90 days is what they're saying your body has the immunity from the virus after you have gotten COVID. And those 90 days are the days that they're asking that people that have had COVID donate blood, because they take, I mean, not blood, the platelet plasma.
Plasma.
And with that plasma, that's what they use to infuse the people that are sick, because it has antibodies in it. So those 90 days, you have antibodies in your system and you're immune for those 90 days. But that the doctors are asking for help and asking that people within those 90 days go to donate their plasma for the antibodies.
And I really hope people go and do that, because it's making such a difference. We had some people in my side of the family come out positive, and with the plasma that they've been receiving, it's made a big difference. Today, one of my nieces went to the ER to get a treatment, and so God willing, we're hoping that that also works as well. And but they are seeing a bigger rapid healing process with this. So yes, if you have been positive, please go and donate. That's the only way we're going to be able to continue and see a change in this.
Yeah. So he I mean, we don't really have an answer for this one, right?
Well, yeah, he did mention that some of the doctors' offices, maybe they're just not familiar with the process of it. So that's why, he's thinking that by next year, a lot more of the doctors' offices will become more familiar with it. And we won't have this problem here, because it will be, spread out with more locations and stuff.
Suggestions when you are sick.
He gave those different suggestions.
We didn't ask this one. What does direct contact mean? We didn't ask that.
No. Sorry, Nelda.
Sorry. What about the children who have been exposed or have confirmed COVID? Do you know the most affected age group? We didn't ask that one either.
No. My gosh, we didn't get any of Nelda's.
We got a couple. You are amazing. We're blessed to have you in Brownsville, Mr. Hernandez. May the Lord bless you and keep you safe and healthy. Yes, Ms. Salazar, I agree.
Absolutely.
How much of the vitamin D did he recommend?
I don't know the exact number. I think he said 90, but I'm not sure. But honestly,
over the counter that there's a 5,000. I think he said 5,000 something.
I don't remember on that one. Yeah, maybe go back. Maybe go back on the video and see what he said on it. Because he did say how much he recommended, but I know he also was talking about the levels that you should be at and stuff, because the majority of people are deficient in vitamin D.
And he said Centrum vitamins were okay, but he didn't think it would be enough. But he did
exactly.
Say that okay.
So that's very minimum in my opinion. And since he said that, you really want to kind of get the specific ones that he mentioned. Because of the virus that is going around.
Yeah. Yes. So they are taking new patients. He did say they were having trouble with phone because there's a lot of calls coming in. So the lines are always tied up. But he said if you drive up to the office, they will come out and take care of you.
Mm-hmm.
So we already covered that one. I have my primary doctor. Would you still? Yes, Mr. Cisneros, he would still help. You just have to go to the office. Thank you. The antibodies infusion. And I can tell you that my husband's cousins and her husband, my husband's cousin and her husband both got COVID, and her husband did end up very sick, and he got the antibody infusion, and that helped him. It was what turned it around for him. So that was a blessing for him. So if you, again, like we said, if you're within those 90 days, please go donate your plasma, because it's saving lives.
Yes.
Yes. God bless him. Yes.
There you go. The address. You already put the address. Yeah. That was earlier.
Yes.
So she was asking for that.
Dr. Eder, Mr. Amigo.
Oh
I'm gonna
gosh.
give all the addresses, and then we talked about this one.
Mm-hmm.
Good night, Miss Maribel.
Thank you.
I don't know what happened. It went all the way to the bottom. Here we go. Thanks. Thank you so much, ladies, for having Dr. Hernandez. Very informational. God bless you all. Your ladies are awesome. Thank you so much.
Thank you. God bless.
Yes, thank you. Biden wants everyone back on. We all want to go back on campus. We just want to go safe.
Exactly.
Good evening. Hope you ladies are having a good evening. Are you excited about the Biden administration? Hopefully we will see change. We're hoping for change, guys. We're hoping. We're praying for positive change, for extra funding for public education. Any money coming in is going to help as far as PPE goes and different things like that. And, an increase in technology, whatever the case may be, any money that comes towards us is going to be great. And that's what the biggest hope that we have, that we see a positive change for that at the federal level. Erasmo said he wants us back. We all want to go back, but we just want to make sure it's safe. And that's one of the things he did say, that yes, we needed to go back, but we needed to go back safely. And at the point that we were at when he stated what he stated, we did not have the financial capacity to go back safely.
Absolutely.
God bless you too, Ms. Garza. You too, Ms. Ramirez. The lines are crazy at the wellness center from BISD. It's scary to see so many people getting the COVID test.
I've heard that the lines have been very long. I don't know if maybe they just need to get more people there or extend the hours or something. But yeah, I've heard it's been crazy.
He said with the trial, you can get the trial one.
That I guess that you could get the trial. Yeah. That's the one. I already answered that one.
Yeah. The COVID protocol that is posted on the BISD website was updated as of December. Hello. I have been a patient of Dr. Hernandez for 2 years. He and his staff are amazing. See, that's what we keep hearing. We do keep hearing.
My gosh, I want to change all the way over there.
I know. But they said they have an office in McAllen.
Yeah, but sometimes even when you have, certain different locations and stuff, it's all on the doctor that is there. And I have just heard amazing things about him. So I don't know.
Yeah.
Website for trial. I can't scroll past the post. Oh, okay. So I guess to put his email address again, the Eder at centexstudies.com. So you can email him or go by the office and do the paperwork. Vitamin D varies. Ask a doctor.
Yeah, so a lot of these things, like he said, you should get a blood work done with your doctor. They will give you your numbers and what you're deficient in, and then you go from there. Yes, he did say 5,000. I remember the 5,000. I just didn't remember the medical that came after that.
There you go.
For the vitamin D, yeah. 30 to 100 vitamin D, depending on your levels. I'm going to look into that. Was interesting.
Mm-hmm.
So is it true you all have to get tested through BISD at Central Building for COVID-19 to be cleared? Someone on Erasmo's show last night said this.
It all depends. You don't have to go through BISD. No, you do not. You can go through your own doctor or clinic, but in order to be cleared, if you were exposed or positive, you do have to show proof of being cleared, but you do not have to go through BISD. So if they're trying to force you to go through there, let us know, because they can't force you to go through that place.
My doctor placed me on vitamin C, D, zinc since the pandemic started. Those are the three that I've heard that's been a constant, those three.
Yeah, and I have been taking that and some more. I have actually been taking the turmeric. So when you mentioned that, I thought that was interesting. And then also the melatonin, I take that as well. So
So
I,
melatonin, I had actually heard that somewhere up, like in Houston or somewhere up there, a doctor had been. I had this conversation with my friend Edward, that a doctor had been using that to treat patients with COVID,
the
and
melatonin.
yes, and he had
Oh,
been
well.
seeing positive results, and in that the melatonin was lowering whatever the symptoms were. They were they were there, but they were not as severe. Uh,
Mm-hmm.
and then when they would remove the melatonin, it would the symptoms would become more severe.
Oh,
So
wow.
I had heard that a while back. I had this discussion with my friend, and so when he said that, I was like,
Wow, that's crazy. So, but I'm assuming, well, I guess you would be taking the melatonin, and it would be okay to be taking it during the day because, if you're sick, you're pretty much going to be resting and
at home.
sleeping. Yeah.
Yeah,
So that's interesting. So, but no, right now I just take it at night. So
yeah. It doesn't put me to sleep though, Ida.
it does to me. It does. Well, it depends. How much are you taking? There's 10, the 10 milligrams. Take
Yep.
two.
Really?
Yeah, you can take two.
Ooh.
You got to try it, or do 1.5, and see how
I
you
may
do.
try that. I may try a 10 and a 5. How about that?
There you go. There you go, and then see how that works for you.
Yeah,
But
well, I'm so glad he was on. We were able to get through a lot of questions, through most of our questions, actually, except for with the exception of a few of Miss Nelda's. We still love
yeah,
you. Um,
yes,
but it was very interesting and informative, and I learned a lot because I had never heard that they were doing the studies on the kids.
I hadn't heard that one either. I'm so excited about that, and that the vaccine lasts a year. That
Yeah,
is amazing. It kind of gives you a little bit of hope that, let's just continue to do our part during this time until they regulate everything, and fine tune this little process of getting the vaccines out, because I know it's very frustrating. Believe me, my sister had been doing an amazing job searching high and low to try to get my mom the vaccine, and thank God, God willing, she'll be taking it this Sunday.
oh,
But it gets very frustrating when she's at a very high risk. Certain people that are very high risk, and you're trying to keep them as safe as possible, and you're worried about somebody being asymptomatic getting close to her, and but then on the other side of it, you're removing all these people from their lives, and then you start to see the other effects of it, where people start getting depressed and start getting anxiety, because all of that starts to kind of build up and catch up with them. So we all have to just continue to do our part. We know it's tough on all of us. It is. I mean, we miss our gatherings, our meetings, our get-togethers, and things like that. But what we just have to continue to do our part until they're able to uh, get this flowing a little bit better.
yeah.
So
I feel like I'm feeling hopeful. Well, for
yes,
a long time I was feeling hopeless.
yes,
And so, I'm so glad he was on. It gave me a little bit more hope. It made me feel a little bit more comfortable. And,
yeah.
so God willing, all these vaccines come in, and everybody here gets the vaccine as soon as possible. I mean, so
Exactly. Exactly.
thank you. Do you have anything else, Miss Ida, that we want to?
That's it. Basically, just for people just to continue to hang on in there, doing their part to stay safe. Because if we think we're overwhelmed and stuff, they're in the medical profession. They're very overwhelmed. They're very tired as well. And we can't be selfish right now, and we need to all do our part to be able to get through this difficult time. So
Yeah. Ladies at Porter, my friend works there. There was a student that went into his class and student tested positive. He asked that he wanted to test himself and they told him no. They asked him if he had his mask and then he was told he does not qualify.
okay. Virginia, let me know on who this is, because if he was exposed. Now, the only thing that I'm thinking of, what they're going with is that he wasn't exposed long enough to that positive person.
A class period in high school is 45 minutes.
Mhm.
Well, if they're not doing blocks.
Okay,
doing
but
longer.
so was the student in there the entire time, the entire period?
Doesn't say.
So
Went into his class. That's all it says.
yeah,
We need a
that's-
little more information, Miss Virginia.
yeah, that's what I'm saying. If the student, maybe the student just walked in and was just there a few minutes, and maybe that's why. But even at that, if you feel you were exposed, if you feel you're having symptoms, you have the right to go and get tested. I would maybe, but then I, like they've mentioned here, I heard it was very long lines at the district one. So I would even go look for another location to do that. She put their close proximity for 25 minutes.
That's well beyond the 15. Hey,
Yeah.
so I do have, and we'll have to get clarification for this. Oh, look, Edward. He's the one that I had the conversation about the melatonin with.
Oh, okay.
Yeah.
Awesome.
He's also the one that's trying to get me the meeting with Lucio.
Oh, okay. Oh, that's good job, Edward. Make that happen. We're waiting.
Yeah, we're waiting. The question is, when they announced at the board meeting that they were going to have these this testing site, right?
Mm-hmm.
Did they state that you had to meet certain requirements to get the test?
No, like what? What do you mean?
Well, how could he not qualify? What are the qualifications? I thought it was just available.
Well, and that's the thing that they kind of like, which is what they've been known to do, and they say one thing and then they say another one at the next meeting. Bottom line is, I would put it in writing, because let them deny that person the opportunity to go and test, and that's where it's going to come back to them. So put it in writing that he is requesting, or this person is requesting to go and test, and demand for them to tell them in writing it's a no. I guarantee you they will not turn it down in writing, because they have said it at a board meeting that if you have symptoms or you have reason to believe you need to go get tested because you were exposed, they will not deny you. They said, oh yes, we're working with them. So let's see, put it in writing to them, request it that way, and let's see if they deny it, and then we'll take it from there for sure. So please do that, or have them do that, Virginia, and let us know if they're going to deny that. And I'm more than sure that they're not going to, but if they do, then we'll go ahead and go higher up on that one.
Yes. Thank you so much, everybody, for joining us this evening. We're so happy that we had the opportunity to have Dr. Hernandez on and get the information that we did. We ask that you please stay strong. Just know that we're here to be your voice until you find your voice. And have a great night. Thank you so much for sticking with us for the hour and 30 minutes that we've been on. And I apologize for my crazy Molly barking because my son got home. So she gets a little crazy. She wants to say goodnight to everybody.
Ah, she loves that camera.
Yeah.
Hi, Miss Molly.
Oh, Mama Theta. Thank you so much for having stayed with us this long. And if you guys have any concerns, please know that you can message us through Facebook Messenger or call our show. Or call our office at 621-3010. Thank you so much and have a good evening, guys. Good night.
Good night.